Hi everyone, my name is Michelle Tolentino, and for my genetics disease project, I decided to go with Prader-Willi Syndrome, also known as PWS. The reason I decided to go with PWS is because I have never heard much about this disease. I also was curious if there is a correspondence between PWS and child obesity. Here I will explain the pattern of inheritance and what chromosome is mapped. PWS inheritance is autosomal dominant, which means it is inherited by one affected parent. Chromosome 15 is the affected chromosome that will cause PWS. There are 3 different scenarios which chromosome 15 can be affected. In this next slide, I have 3 different illustrations showing how a child can result to having PWS. First scenario is deletion, where part of the chromosome 15 from the father is missing. Second scenario is maternal uniparental disomy, also known as UPD. In this case, the child receives 2 chromosome 15s from the mother and none from the father. Third scenario would be the child receives a chromosome 15 from both parents, but part of the father's chromosome 15 is inactive. Now I will explain the physical symptoms found in PWS. First occurs in newborns, where the symptoms may vary drastically from later in the child's life. A newborn will have lower than average birth weight and will have poor muscle tone, which the child will feel floppy due to leg and elbow joints being extended. They also may have unusual physical features, which may include almond-shaped eyes and head narrowing at the temple. The baby will have reduced physical development, will gain weight at a slower rate. It may have some strabismus, which means the eyes do not move in unison. Lastly, the genitals may not develop correctly. These next symptoms will begin to occur in childhood and adolescence. The most noticeable symptom is having large food craving and very high body weight. The child will crave food constantly and eat large amounts of food frequently. They will also have limited growth and strength, including small feet and hands. Limited cognitive development, delayed motor and verbal skills may also be possible symptoms. They may also develop behavioral disorders such as temper tantrums and OCD. Children affected with PWS can also have sleeping disorders such as sleep apnea. PWS is estimated to occur in 1 out of every 1,500 births. However, all gender, races, and ethnicities have an equal chance of having their child develop PWS. If obesity and other complications are controlled, people with PWS can expect a very little life changes. Cause of death included obesity, diabetes, heart disease, and respiratory issues. For prenatal testing, there exists non-invasive prenatal testing, mostly for mothers at high risk. Blood is drawn at 9 to 10 weeks after gestation. As for treatment, currently there is no cure for PWS. However, early diagnosis can help reduce complications by therapy. Therapies that may help improve one's condition are physical speech, sex hormones, nutrition, growth, and development therapy. Assisting in controlling food intake will also keep body weight down. In an article from 2019, researchers were testing and treating infants less than 2 years old with growth hormones. 9 of the infants had deletion type PWS, while 5 had UPD. At the end of their testings, researchers concluded growth hormones were safe for the infants and improved growth and development. Here are my citations and articles